Welcome to the deep dive. Today we're tackling adult ADHD. We've got a stack of articles and resources here, and we're going to sift through them to, really get to the heart of the diagnosis, treatment, and some, well, surprising angles too.
Exactly. Thinking especially about things like misdiagnosis and medication use.
It's complex stuff, definitely. We're aiming to make it clear, useful.
Hope so.
So why should this matter to you? Well, if you've ever wondered about ADHD in adults, maybe for yourself, maybe for someone you know, this deep dive should give you a really solid but still accessible overview.
Cutting through some of the confusion, maybe?
That's the plan. Offer some valuable insights. Okay, let's unpack this.
Right. Where should we start? Maybe the diagnosis itself, how it's different for adults.
Yeah, good idea. Because the criteria do change, don't they? The DSM-5 uses different benchmarks.
Mm-hmm. For adults, you actually need fewer symptoms listed. It's 5 instead of the 6 required for kids.
Which kind of makes sense, right? It presents differently as you get older.
It often does. Adults tend to report more of the inattentive profile. Issues with focus, staying organized, maybe less of that really overt hyperactivity you see in some children.
But the hyperactivity doesn't just vanish.
Not necessarily. It might feel more internal, like racing thoughts. Or it shows up as restlessness, fidgeting, that sort of thing, rather than, running around constantly.
Okay. So for an adult diagnosis, these symptoms, they need to be around for a while.
Yes, at least 6 months consistently. And this is key. There needs to be evidence that some of these difficulties were present before age 12.
Right. It's not something that just appears out of nowhere in adulthood, usually.
Usually not. And critically, the symptoms have to be causing significant problems, real impairment.
In multiple areas of life.
Correct. At least 2 settings, think home, work, school, social life. It needs to be impacting things noticeably.
And I saw something about collateral information. What's that about? It sounds important.
It can be really valuable. It just means getting perspectives from other people who know the person well.
Like family, partner. Yeah.
Exactly. Family members, maybe a spouse, even old school reports or feedback from employers sometimes. It helps build a fuller picture, especially if we're calling childhood symptoms, which can be, tricky.
Yeah, I bet. And lots of adults diagnosed later look back and see patterns, right? Like maybe struggling in school.
Definitely. Many report feeling like they were underachievers, that they knew they could do better, but just couldn't quite get there consistently.
Okay, so if someone's listening and thinking, this sounds familiar, what are some common complaints, the things that might make an adult seek assessment?
Well, difficulty meeting deadlines is a big one. Problems at work, maybe switching jobs a lot or feeling stuck.
What else?
Sometimes issues with anger management. Unfortunately, addiction can sometimes be linked. Strain in relationships, social difficulties, problems really grasping information sometimes.
And family history often plays a role.
It often does, yes. A family history of ADHD is quite common. It's usually a cluster of these things, not just one isolated issue.
Feels like a complex web. The sources also mention correlates things often seen alongside ADHD.
Right. Statistically, we sometimes see links with lower socioeconomic status, more driving violations, sadly.
Driving violations?
Yeah, and more frequent injuries, sometimes legal troubles, also potentially higher rates of alcohol or tobacco use, and just a general self-reported feeling of, well, maladjustment, not quite fitting in.
Wow. It really shows how wide-ranging the impact can be if it's not identified and managed.
Absolutely. It touches so many parts of life.
And it often doesn't travel alone, does it? Comorbidity is a factor.
Very much so. ADHD frequently co-occurs with other conditions. Substance use disorders are common, as are depression and anxiety. They're probably the most likely companions.
Which really highlights why a thorough evaluation is so critical. You can't just look at the attention symptoms in isolation.
Exactly. You need that holistic view.
Now, here's something that caught my eye. The idea of adult-onset ADHD. I thought symptoms had to start in childhood.
That's been the traditional view, yes. And for most adults diagnosed, you can trace symptoms back. But there's research exploring this idea of adult onset.
So people meeting criteria as adults, but without clear childhood signs.
Potentially, yes. It's still being investigated, It could mean a few things. Maybe a later manifesting form, or perhaps major life changes or stressors in adulthood can sort of unmask underlying vulnerabilities.
Interesting. So still some unknowns there.
Definitely an active area of research. We need more data to really understand it fully.
Okay, so given all these complexities, how do professionals actually figure this out? What's the assessment process like?
Well, questionnaires are often used, self-report scales.
Like a checklist.
Sort of, yeah. Things like the ASRS, the Adult ADHD Self-Report Scale. It's pretty quick. Asks about common adult difficulties like focus, impulsivity.
Is that enough for a diagnosis?
Usually not on its own. It's a good screening tool, a starting point, but it's just one piece. A full diagnosis needs more. Sometimes psychological testing might be part of it for a deeper dive.
Right, so it's a comprehensive picture they're building. Now, let's switch gears slightly. The role of a medical evaluation. Why is that so crucial here?
Yes.
Yeah.
Incredibly important because, several physical health conditions can actually mimic ADHD symptoms,
Really? Like what?
especially the inattention piece. Think about things like um, absence seizure disorder
Mm.
or diabetes blood sugar fluctuations can really mess with focus.
Wow.
Thyroid problems, too. Sleep deprivation is a huge one, obviously.
Yeah.
Even things like after effects from a concussion or inflammatory bowel disease.
Inflammatory bowel disease. How does that connect?
It can impact nutrient absorption and overall energy, leading to fatigue and concentration issues. Also, iron deficiency, anemia, even disordered breathing like sleep apnea. All these can cause symptoms easily mistaken for ADHD.
That's quite a list. It really drives home the point that a medical checkup seems essential before jumping to an ADHD diagnosis.
Absolutely. Ideally, yes. Psychologists or other professionals doing the assessment should really consider getting medical clearance first, just to rule these other possibilities out.
Makes total sense. Okay, so someone thinks they might have ADHD. They've considered the medical side. Who do they actually go to for a diagnosis and potentially treatment?
Good question. There's a range of professionals who are qualified. Physicians, for starters.
Like a psychiatrist?
Yes. Psychiatrists. Also pediatricians, though they mostly see kids. Some work with adults. And neurologists.
Neurologist. That's maybe not the first one people think of?
Right, but they can diagnose it. They'll often do a detailed medical history, maybe imaging to rule out brain injuries, cognitive tests, and they can collaborate with mental health folks. And importantly, yes, neurologists can prescribe medication if needed.
Okay. And psychiatrists, you mentioned they're medical doctors too.
Yes, specializing in mental health. So they can diagnose, prescribe meds, and provide therapy. They often have deep expertise in conditions like ADHD.
What about psychologists?
Psychologists are experts in assessment and therapy. They do really comprehensive evaluations, questionnaires, interviews, cognitive testing to understand the issues. But they are not medical doctors, so they can't prescribe medication.
Got it. And therapists, counselors, social workers.
They play a huge role, often the first point of contact. They help identify symptoms, gather history, provide ongoing support, coping strategies. They're vital, often working in a team. They might not give the formal diagnosis themselves in all cases, but their input is crucial.
So it really sounds like the best approach often involves different perspectives. What does that full evaluation typically look like?
Well, it starts with carefully looking at the DSM-5 criteria, of course, but then gathering a really detailed history, childhood, school, work, relationships, assessing the impact of the symptoms across all those areas.
How they function day to day.
Exactly. And also looking for any coexisting conditions like the anxiety or depression we mentioned earlier.
And those rating scales and checklists come in here too.
Absolutely. They're important tools, usually filled out by the person themselves, but ideally also by someone else who knows them well, a partner, maybe a parent if possible, to get different viewpoints on how symptoms show up in various settings.
Could you remind us of a few names of those adult scales?
Sure. There's the ASRS we mentioned, the Barkley Adult ADHD Rating Scale, bears the 4, the Brown Attention Deficit Disorder Symptom Assessment Scale, and the Connors Adult ADHD Rating Scales are common ones. Each has slightly different focuses.
Okay, so diagnosis covered. Let's talk treatment. What are the options for adults and what are some, key considerations?
Right. Moving into management strategies. Psychostimulant medications are, well, they're often a first-line treatment and can be very effective for many adults.
Improving focus, impulsivity.
Yes, exactly. Hyperactivity, impulsivity, and inattention often see significant improvement.
But there are concerns about misuse, aren't there? We hear about that.
That's definitely a valid point and something clinicians take very seriously. Misuse and diversion, meaning selling or giving medication to others, is of a real issue, particularly among, say, high school and college students and maybe younger men.
So how is that managed? How do doctors try to prevent that?
Well, one strategy is often preferring longer-acting stimulant formulas.
Why is that?
They provide smoother symptom control over the day, and the way they release the medication might make them less appealing for misuse compared to the instant hit of short-acting ones. Lisdexamfetamine is an example.
But short-acting ones still get used.
Oh, yes. they have their place, like dextroamphetamine and amphetamine, maybe for specific tasks or times a day, and there are intermediate options too.
What if someone tries stimulants and has bad side effects? I hear that happens.
It does. Maybe around 30% of adults stop stimulants because of side effects, things like poor appetite, headaches, trouble sleeping.
So then what?
Options are adjusting the dose, trying a different stimulant medication because people respond differently, or adding other therapies like CBT, which we should talk more about. And if stopping, it's really important to taper off gradually, not just quit cold turkey.
Okay. And other ways to minimize misuse risk, aside from long-acting meds.
Uh, Several things. Signed agreements about controlled substance use, frequent follow-up appointments, building good communication, using state prescription drug monitoring programs, PDMPs to see what's being prescribed, sometimes random urine drug tests. And really, a team approach involving mental health support and therapy is key.
Sounds quite thorough.
It needs to be. And it's worth saying, research hasn't shown that properly prescribed stimulants for ADHD actually cause substance abuse later on. But patient education is vital. Don't share your meds, don't sell them. Be mindful of alcohol use.
Okay. What if someone just really doesn't want to take a stimulant? Are there non-stimulant meds?
Yes, there is. Atomoxetine is the main one. It works differently on norepinephrine rather than primarily dopamine like the stimulants. It's a good alternative and generally has a lower risk of misuse.
Right. Now, medication is one tool, but therapy sounds crucial too.
Absolutely critical. Non-medication approaches are so important for long-term management and just, well, quality of life.
Like what kind of therapies?
Behavioral therapies, cognitive behavioral therapy, CBT is a big one. It helps people identify unhelpful thought patterns, develop organizational skills, manage time better.
Practical strategies.
Very practical. Also, mindfulness-based cognitive therapy, MBCT, which helps with attention and emotional regulation. Social skills training can be useful for some, even family therapy sometimes.
So it's about developing coping skills, not just relying on pills.
Exactly. Managing symptoms day to day, improving relationships, building strategies that work for them. CBT might help someone break down overwhelming tasks, for example.
It all sounds like quite a journey for someone dealing with adult ADHD. Support must be important.
Oh, incredibly important. It's a strong support network, family, friends who understand, therapists, maybe peer support groups. It makes a huge difference.
Are there specific organizations people can turn to?
Yes, definitely. CHADD, that's Children and Adults with Attention Deficit Hyperactivity Disorder, and ADD, the Attention Deficit Disorder Association. Both offer fantastic resources, information, and ways to connect with others.
Great. Okay, so let's try and pull this all together. What are the main takeaways for our listeners from this deep dive?
I think first that diagnosing adult ADHD isn't simple. It needs careful evaluation to rule out other things, both medical and mental health conditions.
Right. Not just a quick checklist.
No. Second, a team approach involving different professionals and combining treatments, maybe meds, definitely therapy and skills training, is often the most effective path. And third, being aware of the potential risks with medication, like misuse, is important, but so is recognizing how vital a good support system is for navigating it all successfully.
Okay, here's something to chew on then. Thinking about all those medical conditions that can look like ADHD, what can people do proactively to make sure they get a really thorough, accurate assessment, to advocate for themselves, ensuring both body and mind are considered?
That's a great question, because that intersection of physical and mental health is clearly so significant here.
We've really just scratched the surface, haven't we?
We have. But hopefully it's provided a solid starting point for understanding.
Definitely. We absolutely encourage you to check out the resources mentioned, CHEDD, ADDA, maybe look up some of the research we touched on to explore further. What other questions pop up for you about diagnosis, treatment, or just living well with ADHD? Thanks for joining us for this deep dive.